And Dr. Henry, considering how many people in long-term care, both staff and residents, have received the vaccine, how is it even possible that outbreaks are still happening and people in long-term care are still getting sick and dying?
Yeah. The sad thing is that most of the deaths that we've had in long-term care are in outbreaks that started prior to the immunization program starting. And you must remember that we consider a single case of a staff person with potential exposures or a resident as being an outbreak. So we also know that there's a period of time before your body develops enough antibodies to give you protection. And that's about 14 days, somewhere around 14 to 21 days is when your maximum protection starts after receiving the immunization. So what we are seeing right now is the effects that we have not yet passed that critical period of time for everybody who's been immunized. But what we aren't seeing is the rapidly spreading outbreaks that we saw earlier on in November and into December prior to immunization. So, the protection that we're seeing is very robust after their bodies have that opportunity to develop the response. So that takes a few weeks, and it's still building up, but we're getting there.
Richard, do you have a follow-up? Richard, are you there?
I'm here. Yeah, I'm here.
Go ahead.
The outbreak at the George Derby Centre is still happening. It started, as you alluded to, some started before the vaccinations started. But how are we still seeing an outbreak in this facility? How has it gone on so long? And would rapid testing or PCR testing for staff not be advisable at this time to help deal with this ongoing outbreak?
Yeah, so it is the most challenging outbreak that we have, and sadly, the number of people who've died from COVID-19 has been very high in George Derby, and it's been exhausting and challenging for the families, for the caregivers, and for the residents in that facility. And unfortunately, the virus was quite widespread before immunization became available. In terms of testing, obviously in an outbreak, PCR, the more accurate testing is what we do, and it has been done regularly of staff and residents in George Derby, as we do with every outbreak. So there's when we have an outbreak, when we know that there's a higher probability of people having the virus, whether they're symptomatic or not, we do systematic testing on a repeated basis with the PCR testing with the rapid turnaround time. So that is being done in all of our long-term care outbreaks.
Dr. Henry, with two outbreaks at Nanaimo long-term care homes, families there are pushing to know whether all staff members in the facilities that are working closely with patients, whether they've been vaccinated. And I realize there's issues around privacy, but they say that they have a right to know. And if they haven't all been vaccinated, can you tell us why?
Yeah, so we'll be presenting some data on that on Friday. We have collected that staff immunization rates by facility, so you'll know. Nobody has a right to know an individual's immunization status, and that's something that's important for all of us in terms of our own protection. And I will say, with these vaccines that we have, it is also important to know that direct protection of seniors and elders with vaccination themselves is very effective. So unlike influenza, for example, where vaccinating in a ring around people is so important because we don't mount as good an immune response as we get older, that is not the case with these new vaccines, which is really why I'm so excited about them. They work well in older people themselves. That's, miraculous in many ways. So while it is still important, and we will be targeting, there's very few, but there are a few care homes where not everybody, not all the staff are immunized, and what we need to do is make sure we understand why, and we give more opportunities for people to receive the vaccine and receive the information they need to be comfortable receiving the vaccine. That's so important, especially with these new vaccines. So that is something that we'll be following up on. But still, we know that 1 or 2 cases can happen even when everybody's been immunized.
Follow-up, April?
Yeah, thank you. And I know you've been talking about the shortage of vaccine, but I was wondering if you could tell me when second doses might be rolled out in these 2 particular facilities, and whether you're giving any priority for those second doses to long-term care homes that are experiencing an outbreak.
Yeah, so we did initial immunizations in care homes that were experiencing outbreaks as a way of protecting the second generation as best we could, not always successfully depending on the timing. But yes, the residents in particular of care homes are people that we want to get the second dose in this timely way as we can. Some of the care homes that were done later are not yet at the minimum period, so that's something to consider as well. But we are looking at it's less important for younger people, more important for us to protect older people as quickly as we can.
And just April, it's already started. I think I reported earlier, but just important to note about 63,000 long-term care residents and staff have been immunized. About 16,000 have already received their second dose, so that process is on the way. 4,826 essential visitors as well, and many people who are sometimes referred to as ALC patients in acute care hospitals have also been immunized. So we're well on the way there, and in many care homes well on the way for a second dose. And so the detailed information per care home for residents will be provided on Thursday, I believe, or Thursday and Friday, and we'll put that information out for everyone to see. But I think it's pretty uniformly high across health authorities, and pretty uniformly high both amongst residents and staff. And the sheer numbers, our total target in BC for long-term care staff was initially 37,000, is now 39,000, and obviously there's approximately 30,000 residents in long-term care, so you can see the extent of the immunization across the province.